What's up, Doc Mike? Public Health on Call. By Johns Hopkins Bloomberg School of Public Health. Today's topic for April 10, 2021. Solutions. Thank you, Johns Hopkins Bloomberg School of Public Health.
Welcome to Season 3 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Harassment online, harassment in person, threats of violence, and even violence itself. In the last year, amid the pandemic, public health workers have experienced more direct attacks than at any time in the previous century. I'm Lindsay Smith-Rogers, producer of Public Health on Call. This week, as part of National Public Health Week, we're bringing you a special 4-part series with episodes excerpted from a webcast from last month. The webcast was produced in collaboration with the Association of State and Territorial Health Officials, known as ASTO, the National Association of County and City Health Officials, known as NACHO, and the Big Cities Health Coalition. In this series, we will explore the extraordinary challenges facing the field of public health in the COVID era. We'll hear from health officers on the front lines about their experiences, from researchers about the scale of the problem, and from the leaders of ASTO, NACHO, and the Big Cities Health Coalition about what is to be done. In our final episode of this series, we'll hear more about how serious the problems are and what can be done about them. We'll hear from Lori Freeman, the CEO of NACHO, Chrissy Giuliano, the Executive Director of the Big Cities Health Coalition, and Dr. Marcus Plescia, Chief Medical Officer of ASTO, with direct calls to action to break the boom and bust cycle of public health infrastructure to address the COVID-19 and future pandemics and all sorts of other issues that threaten the public's health.
We are all so fortunate to have dedicated and committed public health leaders like Dr. Jonae Khaldun. It is time to stand with her. It's time to stand with public health. Let's now turn to how. Joining me live now are Chrissy Giuliano from Big Cities Health Coalition, Marcus Plescia from ASTO, and Lori Freeman from NACHO. They're going to provide a call to action to revitalize public health. Let's start with you, Lori. What's at the top of the call to action?
Thanks, Josh. Here are 3 action steps to stop the harassment of the public health workforce. First, speak out. Everyone, especially elected officials and community leaders, should endorse this statement. It is the job of public health agencies to protect the health of their communities. In a democracy, dialogue is necessary and disagreement is inevitable, but there is no place for threats and harassment. Public health workers should be treated with respect for their work on behalf of us all. I stand with public health. Next, report threats. Congress should require state and local monitoring and reporting to the CDC of threats and harassment against public health workers for performing their official duties. This includes threats related to race, religion, sexual orientation, or gender. And finally, use the law to deter and protect. State and local prosecutors and law enforcement leaders should utilize existing statutes, as well as support new laws as needed to protect public health officials from threats and harassments.
Thank you, Lori, for offering these first 3 action steps. What do you want public health workers across the country to know today?
In the midst of this worldwide pandemic, public health is under attack, and that should frighten us all as a country. Our health departments are under attack simply for doing their jobs. As you've listened to today, across the country, in red states and blue states, large metropolitan areas and rural communities alike, public health department officials and the staff that serve those departments have been threatened and politically scapegoated for nearly a year. Too many in our field have lost their jobs for trying to protect and defend the health of their community in responding to the COVID-19 pandemic. Many others have stepped down, interrupting their careers to protect themselves and their loved ones from actual or perceived threats. We are losing expertise, experience, and most importantly, leadership at a time when we need it most. Compromising the role of public health officials makes our nation less safe. Public health departments are the unsung heroes and ultimate defenders of our health. Before there is a COVID test, before there is a patient, before there is an ER visit, there is prevention. This is public health. This is why it is important, and this is why we need it. We have to protect the role of our public health departments. The experts who comprise our public health departments are true heroes. We should be thanking them for their tireless work and heeding their advice, not threatening their safety, their careers, their livelihoods. NACCHO stands behind all health officials and the staffs that serve their departments. We see you, we trust in you, we are with you, we stand with you. And NACCHO will never stop fighting for you to restore trust in you, in your staff, in the field you've chosen to so nobly serve public health. Thank you for your strength in your service to our country.
Great. Thank you so much, Lori, for those important points. And now to you, Chrissy Giuliano. What's next on the action agenda to revitalize public health?
So we need to reject efforts to sideline public health. Number 4 is do not lose ground. It is important to defend the statutory authority of state and local public health agencies. In a crisis, public health measures protect communities against widespread illness and death.
So, Chrissy, tell us more about why these statutory authorities are so important.
The powers given to health officials are the foundation of so much of the work that happens in cities, counties, and states across the country, from regulating tobacco to enforcing routine vaccine statutes for kids attending public school, to requiring quarantine for those exposed to measles, for example, not even during a pandemic. These authorities are critical to protecting the public's health. Having these authorities stripped at the local or the state level would really leave the field without one of our most important tools and make it harder for us to keep people healthy and prevent disease.
I'd like to now go to Marcus. Marcus, health agencies have suffered a terrible loss of funding and staff. What needs to be done?
Josh, what we need to do now is rebuild the United States public health infrastructure. This is an infrastructure that has not been invested in adequately in decades. Many health departments are facing personnel shortages, and they're forced to rely on outdated and fragmented systems and infrastructure. A major federal investment in public health infrastructure at all levels is essential to identifying and responding to public health challenges in real time. There's 2 specific things that we really need to address right now. First of all, we need to invest in the public health workforce. The Biden administration has proposed funding for 100,000 new public health 100,000 new public health workers to aid in the COVID-19 response. That's great, but the federal government has to sustain this investment going forward. And they have to do things like expanding scholarships and loan repayment systems that will help us to fund and recruit and retain a diverse and effective public health workforce to help protect the nation. And then the other thing that we need to do is we have to modernize the public health data systems. We know how to do this. We've been thinking this through for some time now, and much of the ingredients can be found in the CDC's Public Health Data Modernization Initiative, which sort of lays out the roadmap for what we need to do. We need to use that initiative to upgrade critical systems and technology and facilitate electronic data transmission and enable a number of interoperable data exchanges.
Now, Marcus, let me ask you a question. Would we have to wait for the next pandemic to see the benefits of this kind of investment in public health?
No, we need to make these investments now, not just to deal with the current COVID pandemic, but we every day we face a wide range of public health problems. People are familiar with things like the opioid epidemic, obesity, tobacco use, vaping. I mean, all of these things would benefit so much if we could make this investment in our public health systems, not just in our workforce, but in the data systems that we need so badly. I mean, we about a decade ago, we made major investments in the medical care data systems with implementation of electronic health records, with meaningful use incentives to really help push providers to using these systems properly. We need to do the same thing for public health, and we need to bring it up to the same level.
Great. I want to see if either Lori or Chrissy wants to jump in on that question, whether an investment in public health infrastructure, how that kind of investment would make a difference for health now.
I think it's critically important for us not to continue this boom and bust cycle that we have in public health. We need to make investments today to be able to help folks respond to the pandemic, but then build back the workforce so we can continue to prevent things like this and other diseases and challenges moving forward.
Great. Lori, anything you want to add?
I would just add that this will not be the only threat that our country, our world faces. And we have a lot of rebuilding of public health to do, but it can be done. We can rebuild public health so that we're ready for whatever the next threat is. And we won't be playing catch up during the next time. We'll have sustainable resources on the ground ready to cope with anything that comes our way. And that's really the important piece of this, to keep our communities safe long term.
Got it. So that call to action, 5 steps to stand with public health. Now, I've just received a statement of support for those 5 steps from Dr. Georges Benjamin, the Executive Director of the American Public Health Association. I'm going to read it. He said, quote, "I am honored to voice the American Public Health Association's endorsement of this coalition that fosters community engagement, collaboration, and a commitment to science at a time when our appreciation of public health's life-sustaining work should be greater than ever. I ask all communities to join in taking the pledge," this is Dr. Benjamin, "of calling on our elected officials to revitalize our public health agencies, amplify the voices of science, and reinforce accountability when those voices are sidelined or threatened. Together," he says, "we will rise to meet the challenge of restoring hope, trust, and safety in our efforts to end this unprecedented health crisis so Americans can live as long and as well as they can without worry." Thank you so much, Dr. Benjamin, and thank you to the American Public Health Association for endorsing this call to action. Now, you can also endorse this call to action. We've created a website for anyone to visit to see these 5 action steps and to add your endorsement. Please visit and share standwithpublichealth.jhsph.edu. That's standwithpublichealth.jhsph.edu.
Thank you so much for joining us for this series. Tomorrow, in recognition of National Public Health Week, Dr. Josh Sharfstein will be speaking with Dr. Georges Benjamin of the American Public Health Association about the state of public health.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, C.N. Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.